guys, Dr. Brotsky here. This is the third month of your pregnancy. If you haven't checked out the other months, take some time to do that. So technically 3 months of pregnancy is the 12 to 16 week range. So this is in gestational age that your doctor will go off of. Welcome to the second trimester. The second trimester is so much better than the first. You're gonna have a lot more energy. You can also expect to take less naps, which is great. Your nausea will probably start to improve, and you'll be able to cut back on those cravings a little bit if you've had those. People will often have food aversions in the second trimester as well, and this will start to improve in the second trimester as you go through it. You may start to feel the baby move around this time. 16 weeks is the early end of that, so most patients don't feel it at 12 weeks, but at 16 weeks, especially if you've had a baby before, that may become more obvious to you, especially at night. You may start noticing that you get a little short of breath when you exert yourself. That's very common, very normal. Talk it over with your doctor, because sometimes we pay more closer attention if you have more risk factors for lung disease. But in general, you're expected to get more winded and have palpitations when you exert yourself. As far as a doctor's standpoint goes in the third month, your doctor's probably going to talk with you about the flu vaccine if it's flu season. So that's recommended because pregnant women are in an increased risk category along with infants and the elderly from influenza. So just be aware of that. We always want you to be protected as much as possible, and your doctor will likely recommend that if it's flu season. In this month, you're also going to get your genetic test results probably, which will tell you if you are high risk or low risk for certain testable genetic chromosomal conditions. So that's always reassuring to get back if it's normal and helps prepare you if it's not, but there are diagnostic options available to find out for sure. You can also start to get constipated, and your doctor may talk with you a little bit about increasing your fiber intake or your water intake if you need to. If you were put on progesterone early on in your pregnancy, we usually stop that about 12 weeks. So this is the time when the placenta usually kicks in and starts making its own progesterone, so that's exciting. Also, in the first trimester or early second, we'll often do an early glucose test for patients who are at higher risk of gestational diabetes. So lucky you, you get 2 of them. You get one in the second trimester and then one in the close to the third. So if that's you, I'm sorry, but we're just looking out for you and your baby and making sure that that's not an issue. Things that you can be doing right now are staying active, continue to exercise, drink lots of water, take your prenatal vitamin, start investing in some extra pillows or a maternity pillow, because once you get to the 16-week mark, we want you to lay more on your left side or your right side and get off laying flat on your back. So you may need extra pillows for that. Also start thinking about the hospital you would like to deliver at. Your doctor probably has privileges at certain hospitals, so that's something that you want to talk over with them and keep in mind. So that's it for month number 3. Thank you so much for checking out my video. Feel free to check out the rest of my videos on this channel, and I also do weekly pregnancy videos. Thank you so much, and you can also visit me at drbrotsky.com.